Daktari, talk about low blood pressure. So this is a low blood pressure video. So, low blood pressure can be a sign of shock. And shock is a medical emergency. All right? And shock is life-threatening. If you don't mitigate the underlying problem, it can be very life-threatening and it can lead to permanent organ damage. So shock means that globally, the whole body, from top of your head to the tip of your toe, is not receiving enough blood. And you know that blood carries oxygen and all your cells depend on oxygen 100% for the normal functioning every second and every minute. And so when you have shock, it means your brain is not getting enough blood, your kidney is not getting enough blood, the heart muscle is not getting enough blood, the liver, and all the cells and all the tissues in the body aren't getting enough blood. This is a critical state that requires rapid evaluation and immediate start of mandatory treatment. Usually, people with shock will go to either intensive care unit, which is a higher level of care. These are people who will not go to the medical floor. These are people who will go to higher levels of care for intensive monitoring. You want to monitor that blood pressure every second, every minute, just to see what is happening. So people who go to ICU means they have shock and two organs that are failed, or if there's only one organ which is malfunctioning, they usually go to high dependency unit. High dependency unit means the patient doesn't really need a lot of support, just intensive monitoring, but the treatment is lower. ICU means full support. All right. So what are the symptoms of shock? All right. So one of the most important symptoms is a drop in blood pressure, sudden drop in blood pressure. So blood pressure, which is normal, is 90, that's the systolic one, over 60, that's the diastolic. And there's something called mean arterial pressure, which is calculated from the systolic and the diastolic. We want the MAPs, they're called MAP, mean arterial pressure, should be more than 60. So if you're seeing blood pressure of 89, over 59, and MAPs of, let's say, 59 and less, and this is sudden. Let's say the patient's normal blood pressure is usually like 130 millimeters of mercury, and then suddenly it's less than 90 over 60. That means that patient is hypotensive and they could be in shock. The second symptom is a rapid heart rate, what is called tachycardia. So if the heart rate is above 100 beats per minute or more, 110, 120, 130, so that is another sign or symptom of shock. And then the third symptom is your patient is just rapid or shallow breathing. They're not really breathing enough, adequate breathing. They're just breathing very fast. For Indians, Caucasians, or light-skinned people, you will see a pale skin. For Africans, it's difficult to see a pale skin, but the skin will be so cold. The body will be so cold because blood is not reaching where it's supposed to reach. And then for most patients, they'll start being confused. The lethargic and so confused. They can't tell you what their name is. They can't tell you where they are at that point. Some might not be able to remember where they come from or what time of day it is. So that's confusion and it's a sign of shock. So when the blood pressure is low or hypotension or hypoperfusion, it leads to, the body just doesn't get enough oxygen at the cellular level. So when there are issues with oxygenation at the cellular level, as I said, the cells depend on oxygen 100% to carry out their function. So this will lead to cellular dysfunction, and cellular dysfunction will lead to organ dysfunction. The organ that's most commonly affected is the kidney, the brain, the heart, and just all the other organs will be affected. And a patient can they can get one organ failure, two organ failures, or just multi-organ failure. It's called multi-organ failure. The more the organs, the the bigger the disease, the burden of shock on the body, and the outcomes also depend on how many organs have failed. All right. So usually we take these patients to higher levels of care, either HDU and ICU, and then we start to support their blood pressure in what is called pressor support. So you'll hear us saying we need to start norepinephrine because we need to boost the blood pressure to above 90/60 and MAPS of above 60. Usually, if your blood pressure is 90/60 or above, like 95, 96, 100 and more, and if your mean arterial pressure, which is it's calculated, when your mean arterial pressure is above 60, it means each and every cell and organ in your body is receiving adequate blood supply and is getting adequate oxygenation so that it works optimally, so that your cells work completely well. So we will start to support the blood pressure. That's the first thing. And then we will do what is called a blood gas analysis, because we want to see if how much acidosis is in your body. And if it's acidosis, where is the source of the acidosis? Is it your lungs or is it your blood? And then we want to see the lactate. Usually lactate is a byproduct of metabolism. And if the lactate level is elevated, it means that you're not perfusing your organs. It means that the last organ is not getting enough oxygen. So it helps us to manage you. And then we need to identify the source of the shock. So there are very many causes of shock. The first cause is if you're losing a lot of blood or volume. For example, if someone gets a road traffic accident and then they get a cut, the bleeding, if you bleed so much, you can go into shock. Or if you're having excessive diarrhea, you're losing a lot of fluids, you can go into shock. The second most common is sepsis, which is infection, profound infection in the body. So sepsis leads to the arteries and the veins become dilated. So when the arteries and the veins become dilated, the blood pressure just goes down, because you need some vasoconstriction for the arteries and the veins to deliver blood to where it's required. The third cause of shock is if you have something obstructing blood flow out of your heart. If you have a big pulmonary embolism, a huge clot sitting on the chest, it makes the right side of the heart difficult to deliver blood into the lungs, and so you go into shock. Or if you have a lot of blood accumulating, a lot of water or fluid accumulating around your heart, it prevents your heart from squeezing, and so it goes into shock. The other cause is anaphylaxis. Anaphylaxis means a severe reaction either to food, to bee sting, or insect bites, or even to medicine. So it leads to widespread vasodilation, and then you can go into shock. So those are the causes. So our job, when the patient comes to us, or the other important cause of shock is cardiogenic shock, when the pump just fails. The pump just fails. It's not working the way it's supposed to work. So then there'll be reduced output and the blood pressure will go down. Very important. Why am I forgetting my department? Our job is to assess what is causing the shock at this point. Like the patient I had last week, she had cardiogenic shock, meaning the pump had failed, and she also had sepsis and septic shock. So it was a combination of things that made her go into shock. So I arrived and she was struggling to breathe. Her blood pressure was 70/50. And so we took her to ICU, started norepi and just intensive monitoring, started antibiotics and everything. So that is the cause of shock. So hypotension can lead to shock. All right, but it comes with more symptoms and signs, and your patient will just be very, very sick. If your patient is so sick and the blood pressure is low, that could be shock, and you need to escalate care for that patient. Remove them from the ward if they were in the general medical flow and take them to a higher level of care, HDU, ICU, and then you sort them from there. The first step is to stabilize the blood pressure by supporting it with norepinephrine or epinephrine or whatever you have in your hospital, because it can lead to mortality. And then after that, you need to rehabilitate your patient once they recover from shock and once you discharge them from ICU.